Today, we are going to discuss 2 cognitive distortions, or 2 unhealthy thinking patterns that can contribute to increasing symptoms of depression and anxiety. When I run into someone that is quick to label another individual because of their poor behavior, or who is often critical or pessimistic overall, I am inclined to believe that they are highly likely treating themselves in this same negative way.
Perhaps they have labeled themselves with a negative characteristic, or they are critical towards themselves. It's interesting to realize that an unhealthy thinking pattern begins with negative thoughts towards self first before eventually pouring over into others. I believe much of our freedom from some mental health issues can come as we continue to work on what thoughts we allow ourselves to have or not have. This is also why I focus on understanding those unhealthy thinking patterns.
Mental filtering is exactly what the name can be assumed to mean. A filter for the mind. However, this is a filter that only allows the negative to come through. Individuals that fall into this mental filtering trap dwell only on the negative, resulting in them being critical of themselves, of others, of situations, of anything, really.
Individuals that tend to have this cognitive distortion will not realize how much they are ignoring the positives, but instead allowing their minds to highlight only the negatives. It is no surprise that this unhealthy thinking pattern worsens symptoms of depression and anxiety and can make one tend to feel hopeless.
And a couple of examples of mental filtering are always seeing the glass half empty instead of half full. And when receiving something like a job review, the focus is only on the one criticism rather than all of the praises that have been given. And the second unhealthy thinking pattern we will look at today is called labeling. Labeling is putting labels on others or yourself based on behavior or based on a single event or action. And if we label individuals very quickly, it can definitely result in someone being mislabeled or misunderstood.
Examples of labeling are calling someone a drunk, another a liar, a failure, and so on. The poor choice of labeling self or individuals based on behavior in this way can cause us to underestimate ourselves or others.
When we choose to put a label on someone, giving them a negative characteristic based on their behavior or a one-time event, this can lead to those individuals choosing to define themselves with that label.
It can be how they identify who they are, and they could potentially allow themselves to be boxed into this label and never believe they can gain growth as a person, thus changing their behavior.
And honestly, we sometimes do this to ourselves as well. We fail one exam at school and believe that failure is now a part of who we are, which can result in being very discouraged to continue to try harder next time we have a test or any assignment. Labels have a lot of power, and they can lead our actions and our intentions and how we treat others.
Be sure to catch part 2 to gain tips with how to overcome these unhealthy thinking patterns.